This video is going to look at constipation and massage. Constipation can be an annoyance for pretty much everyone at some point in their life, but for some people it becomes a chronic, a really long-term condition that causes significant pain and discomfort and affects the quality of life. How many people this affects varies according to age, social demographics and country. And also perhaps diet, definitely diet. One study where people self-reported being constipated found that 5% of Germans considered themselves to be constipated against 18% of Americans. Constipation is not an illness in itself, it's a symptom of another illness or a condition. It can be as simple as being dehydrated or a diet too rich in processed food which doesn't include enough fibre. Stress and depression can have an effect on digestion, making bowel movements sluggish, and some medications cause constipation as a side effect of the drug. Being too sedentary or not being able to go to the toilet when you need to, perhaps because of work, can also cause constipation, as can severe trauma or poor childhood toilet training. In rare cases, there might be a serious underlying illness which needs further investigation. Now, there are some very specific contraindications for treating constipation. First of all, if someone has blood in their stools, unexpected weight loss, then massage is contraindicated and they need to get checked out by their doctor. Don't use this massage on a client who's pregnant. Don't use this massage on a client who's had recent abdominal surgery, that is within the last 6 months. Don't use this massage on a client who has Crohn's disease or a leaky gut. Don't use this work with someone who has or is suspected to have an abdominal aneurysm. These can often go undetected, but if someone is experiencing back pain or has a strong pulse sensation near their belly button, or if indeed when you put your hand there you can feel an unusually strong pulse there, then don't treat and get them to get checked out. Here in the UK, the most at-risk group for this are older men, and they're now screened once they turn 65. It's treatable as long as they're caught before they rupture. Once it ruptures, there's nothing you can do. If the constipation goes on for longer than 3 weeks, despite making sure that you're properly hydrated, eating roughage and moving around, then the client needs to get checked out by their medical practitioner. So the aim of our treatment in this is twofold. First of all, it stimulates peristalsis, the movement of food and liquids and waste through the intestines. And secondly, it very gently increases the pressure in the abdomen, which encourages rectal loading. Abdominal massage is very effective in relieving constipation, and it's safe to use with children, adults and the elderly. It can be a treatment given by someone else, or it can be self-administered. There's 2 key caveats with this work though, assuming none of the other contraindications apply. First of all, this is gentle work. We're not trying to physically force anything out. We're working with the body to gently encourage movement, so no deep work. You don't want to cause any kind of bowel rupture. And secondly, it's important to work with the natural flow of the bowel, which is clockwise, and to work both the small and the large intestine. There's some more information describing the function of the bowel in the textbook, so it's worth reading that at this stage before you move into treatments. I usually carry this treatment out through a blanket or towel, but it can be done direct to skin with oil if your client's comfortable with that. If you place a towel parallel with the top of the hip bones, so that it's the lowest point you should work, and another at the bottom of the ribs, you have the area in between those 2 towels where you can work and while maintaining your client dignity. Relief should be fairly quickly following a treatment, and passing wind during the treatment is quite normal, but the treatment can be repeated as needed if one treatment isn't enough. Encourage the client to drink water after treatment to ensure they're well hydrated. If you're working with a child, the treatment can be made into a game, or for persistent childhood constipation that's got no underlying condition, then gentle abdominal massage can be part of the bedtime routine. This massage is also good for diagnosed irritable bowel syndrome. And again, I stress the diagnosed, so it's something that has been medically checked out, not just somebody who's saying that the problems they've got are IBS. But again, work gently. So let's come to our practical work for constipation, and this is also cross-referenced to a few other treatments as well. We're doing this abdominal work. I'm working here direct to skin because Peter was happy with demonstrating this and you can see it better. But particularly a lot of women will prefer to work through a drape, and that's not a problem at all. If you're doing that, just get your boundaries. So the top of the hip bone, and I will normally place a towel there so that I know I'm not going any lower than that. And the bottom of the ribs, so I'll place another towel there, so I've got this area that I'm working, and I can work safely knowing that I'm not straying down into areas that I shouldn't be, and I'm not working onto the ribs. But for now we'll work direct to skin. So if somebody's been suffering from constipation, they're going to feel a bit uncomfortable, we need to get things moving. We're starting this treatment just by some very gentle rocking. And again, it's a gentle treatment, even though it might not look it. We're only working very gently. So we're just going to gently rock. You can shake as well, but gently rocking is good. Just for 30 seconds or so. And then we're going to start our detailed massage by working on the small intestine, the inner part of the body, the belly. What we're never doing is working directly into the belly button. It can be a very sensitive area. Some people will hate being touched there, and you're likely to get told off by your client. So just avoid the belly button. We're always going to work clockwise because that's the way the digestive system works. So we want to make sure we're always working with the body. We're going to start here down at the bottom of the small intestine, and you can see I'm working with Peter's breathing. So as he breathes in, just take a nice deep breath in for me, Peter. As he breathes out, I'm just following in and I'm just rocking. So it looks as though I'm working really deep, but I'm really not. As he needs to breathe again, I'm coming up, so I'm never maintaining the depth as I'm never maintaining a push in as he needs to breathe. I'm missing across the midline, and just a nice kind of natural breath for me, please. If as you're working here or anywhere in the belly you feel a really, really strong pulse, just avoid that area. There's some major arteries and running through here, so you don't want to be putting direct pressure onto them. So you can see I'm sinking in. With the out breath, I'm coming up with the in breath. If your client's breathing a little too quickly, just encourage them just to slow their breathing slightly. I'm only going into each area 2 or 3 times. And sometimes as you're working, you will feel the compacted fecal matter. You'll feel that hardness there. See, I'm just sinking in it. It becomes very rhythmical. So I'm coming down with the out breath. I'm coming up with the in breath. And you'll find different clients will breathe at different rates, so just follow their breathing pattern as much as you can. If it seems like they're hyperventilating, then obviously just talk them through it. Some people will do a really deep breath with this, kind of like when you're at the doctor's and they ask you to breathe deep. But then if you breathe as deeply as they ask you to all the time, you end up hyperventilating. So just kind of guide your client through this if needed. I'm just going to go one more time around the small intestine, and then we're going to go move outwards towards the large intestine. So you can see I'm only going up as far as the bottom of the ribs. And although it looks very deep work, it's really not. Take a nice deep breath for me again. Nice deep breath for me. And then I'm coming across to start to work on the large intestine. So I'm just moving out. Generally, if you've got kind of 3 press and releases on the small, you'll probably only get 2 on the large, just because you've got that drop in the ribs. And here as well, you can do a little rock once you get to the large intestine. So I'll follow that breath again. I'm going in and I'm just gently rocking. I'll show you on this side so that my hand's not in shadow. You might only get 1 rock in. It depends really on the client's breathing rate, how far you'll get. Now you can repeat that again a little bit deeper but we're not going too deep. The ideal thing is do that kind of one round at that depth, the small intestine, then the large intestine, and see how the client gets on. Sometimes it can be fairly instant results. I've had clients leave messages on my voicemail that they've arrived being really constipated, and then by the time I get out of my next treatment, I've got a message on my answer phone just to say I've been, and the treatment's worked. So here I'm just doing that rocking again, but now I'm rocking over the whole of the belly. And that's just a really effective treatment for constipation.